West Nile virus. It's carried by crows, right? And it's transmitted by the mosquitoes, and that can result in partial paralysis. Okay, so we have equine herpes virus, myeloencephalopathy. Sorry, it's a hard one. And so that was L, right? So that's the one that results in a lack of coordination, recumbency, and urine gurgling. So that's a little bit unique to that blood disease. Okay, so number 6, equine infectious anemia. Does anybody remember what was unique about that one? Coggins, yep, exactly, so that was I. Okay, so EPM, number 7. Does anybody remember what was unique about that? What was that? Yes, so that's the possum one, and it affects the central nervous system. Okay, equine paraplasmosis. Yes, it is transmitted by ticks. And what's the common symptom in the acute form? Anemia, right? Okay, so what about rabies? What's it carried by or transmitted by? Skunks, right? In Kansas, skunks are the most common way that rabies is transmitted. And then equine influenza. Yeah, so that's the most common respiratory disease, right? Do you guys have any questions on any of these?
How many tents? Yeah, good. Good deal. All right. Again, those quizzes are going into that pile where we're going to count 12 and then drop low scores. So that'll be factored in there. If you didn't do well on this one, it might be a drop. If you've got others you didn't do well on, maybe this will be better. So, just have the edge taken off of them. Some people show them when they had ACE as well. Most associations don't allow it, and if they test for it and find it, they'll kick you out. But there are definitely horses shown with ACE on board, and there are horses sold, shown to potential buyers with ACE on board. Okay, you can give it IM, and if you do that, it's going to take a while for it to take effect, half hour, 45 minutes. Give it IV, it's going to take effect much more quickly. Okay, anywhere from 10 to 15 minutes, you'll start to see the change in the horse. Okay, if you give it IM, it takes longer before it takes effect, but then the effects will last longer. Okay, with IV, you're going to get a more potent dose quicker, and it'll wear out quicker. Okay, so depending on how long you want the horse to be calm, okay, would determine largely which graft you give it. Okay, sedation generally is going to last from 1 to 3 hours. And you can also give this orally. So for people who don't like to give shots, they'll take a cc of ACE and just squirt it in their mouth. Okay, it can be given orally as well. So this one, for sure, there's uses for it, but there are also some unethical uses for it. So it's just one of those you need to be aware of. Okay, we've talked about some of these analgesics before. We've mentioned Banamine. What do you give Banamine for? Colic, right? It's really effective for visceral pain. Okay, so anything involving internal organ pain, we use Banamine. Okay, also known as Flunixin. Okay, it's an NSAID. It's a non-steroidal anti-inflammatory drug. Okay, anti-inflammatory. It reduces fever as well. Okay, so sometimes if the horse is sick from some sort of infectious disease, we want to bring the fever down, we can use Banamine to do that. By far the thing most people would associate Banamine with would be using it for colic. Okay, going to be effective to help alleviate that type of pain in the horse. This also can be given orally. You can buy it in a paste, you can buy it in a powder, you can also buy the injectable form, you can give it in the vein or in the muscle. It would be pretty rare that we would give it in the muscle because it is irritating. Okay, you can dissolve it in water. Okay, put it in hot water, mix some molasses in it, put it in a syringe, squirt it in their mouth. Some horses will cooperate, and some horses won't. So, it sounds pretty easy, just give it orally. In reality, with some horses, it's not the easiest thing to do. Okay, they will take bute better than they do some other things, but it can be a little bit tricky. So you've got paste, you've got tablets, you've got powder. And like all of our NSAIDs, we cannot maintain them on this for weeks on end. Okay, we will cause ulcers, we will cause other problems. Okay, so it's one of those things we can use short term, can be used effectively to alleviate pain, but you cannot take an old horse with navicular disease and put her on 4 grams of bute every day for the rest of her life. Okay, so it's short term only. This one is pretty inexpensive. Okay, so this one's used a lot. It's pretty effective, pretty cheap. You can get your horse to take it. Some of them you just crush up the pills and they'll eat it right out of the green. So this one is one of the most heavily used drugs in the equine industry. Okay, well, what if they get sick? They've got some sort of infectious disease. What do we do with that? Well, there are a number of antibiotics on the market you can use. Okay, the old standbys, protein, penicillin, or PPG. And the penicillin is the antibiotic part. Protein is basically an analgesic to help make it easier to give the injection, and less burn, less pain when you give the injection. So penicillin is pretty much always going to be protein penicillin. It is effective against gram-positive bacteria. So we kind of need to know what sort of bacteria the horse is dealing with to know whether penicillin is going to work. Okay, just because he has a fever doesn't mean you should start him on penicillin. Okay, it's not going to be effective against everything. Only gram-positive bacteria. Okay, one of the big issues with penicillin, okay, the dose on it is 3 to 4 mils per 100 pounds. Okay, so a 1,000-pound horse. What's the dose on a 1,000-pound horse? About 30 mils. Okay, how much of it should you inject in one location? How much of anything would you inject in one location? The recommendation is generally we don't want to do more than about 10 milliliters or 10 cc's in one location. Okay, so a dose here is 30 to 40. So one dose of penicillin is not the easiest thing to get. You could stick your horse 4 different times in 4 different locations. What most people will do, they'll stick them and they'll give about 10 and they'll pull that needle out most of the way. You don't quite come out of the skin and you'll redirect it. Okay, so you stick it in this way, you pull it out, you stick it in this way, give them another 10, you pull it out, you stick it in this way. So it's a big injection. And you have to give it for up to a week. And so smell. Some people say it smells like garlic. I don't really think it smells like garlic, but it has a very unique smell, and you will taste it if you get it on you. Okay, so if you go to the festival and you're like, what's that smell? It's probably DMSO. And if you get it on you, you're gonna know exactly what it smells like, tastes like. So you wanna wear gloves when you handle DMSO. Okay, so we've talked about vaccines. Most of our vaccines are given with an intramuscular or an IM injection. A lot of these antibiotics are given with an IM injection. Okay, so if you need to give an intramuscular injection, there are 3 places where we would generally do that on a horse. Okay, one is going to be the neck. One of them will be the chest, down here between the front legs, okay, in that pectoral muscle. And the other one would be on the back of the hip. And we want a large muscle mass so that we can go into it without hitting a bone or hitting a ligament. We just want it to go into the muscle. And we want a muscle that the horse uses, okay? Because that'll help to disperse that medication and alleviate any sort of soreness or issues afterwards. So we want a large muscle mass that the horse uses. Okay? When you are giving an IM injection, you want to put the needle in and you want to aspirate. Pull that plunger back. Make sure you don't get injured. Okay? If you're getting blood, you're on a vein, and that's not where you want to be. So you would need to redirect it. So aspirate, make sure there's no blood. If you are giving something like penicillin that's got to be given for 7 days in a row, each time you go out, you're going to want to do a different site. Okay? You do the right side of the neck one day, you'll do the left side of the neck the next. You do the right hip one day, you do the left hip the next. So the idea here is once they've had a shot, they're going to be a little sore. Don't go right back into that same spot, go somewhere else. Okay, if you're giving an intravenous shot or an IV shot, you're giving Banamine or you're giving Bute IV, where do you give it? In the neck. What are we aiming for? The jugular. Okay, so the jugular vein runs right in this groove right here. That's where you want to give it. Okay, with IV injections, it's imperative that you hit the vein and not the carotid artery. Okay, it is absolutely imperative that you get it in the vein and not the artery. And both of those happen to run right here. Okay, so how do you prevent getting in the artery? Well, one, if you give this up closer to the head rather than down here, you're more likely to hit the vein. The 2 of them start they get further apart up here. They're very close to each other down here. The other thing, when you put the needle in, if you take the syringe off, if it comes shooting out under high pressure, okay, you're in an artery. It's not where you want to be. If it just kind of drips or dribbles out, you're in the vein. You're where you need to be. The difference is if it's in the vein, where's that blood headed? To the heart. And it's going to get mixed with all the other blood from the body. And then it's going to be pumped out to the body. So the drug gets diluted. But in the vein, it goes to the heart, it gets mixed with all the other blood, and by the time it gets out to the body, it's diluted. If you put it in the carotid artery, it goes straight to the brain. The horse will have a seizure, and it will probably happen before you can pull the needle out. And the horse will go down. Some of them will, and there depends on what the drug is. If it's water soluble, you're better off, but depends on what it is and how much you gave. Some horses will be blind for 3 to 5 days afterwards. I mean, it's a bad deal, okay? So make sure you're in the vein rather than the artery. And that's why a lot of people are a little nervous about IV injections. Okay, so we want the jugular vein. We want to avoid the carotid artery at all costs. Okay, needle sizes. When we give injections to horses, most of the time we use an 18, 20, or 21 gauge needle. Which one of these has the largest diameter? 18 necessarily prepare it. What you've got to do is shave the hair, clear down to the skin, scrub it, let your Nova Sand sit on there for 2 minutes, wash it off with alcohol or something, and then give your injection. Most people don't want shaved spots on